Hello, everyone. As you know, I am Angie. I'm DPW Canada's current president, and I'm really happy to be here. Before I do any more introduction, I would like to start us off with a land acknowledgement. This was actually provided to me by Karen. It was just so well written that I decided I wanted to use this one. So, with great reverence, we acknowledge that we are meeting from across Canada upon the traditional lands of the First Nations, Inuit, and the homeland of the Métis. For thousands of years, traditional people have been the keepers of this land and have preserved it along with the animals and the natural resources. As an organization created by settlers, we also acknowledge our role in the impact of colonialism on the Indigenous peoples of this land. We are grateful for the opportunity to work with Indigenous peoples to create a safer and more abundant future for all women and girls. We acknowledge our activism role in reconciling the 94 calls to action established by the Truth and Reconciliation Commission of Canada, as well as the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls. So that being said, I would like to take a moment just to welcome everyone. I'm very excited that we are having these conversations and that we've chosen this priority theme to focus kind of our efforts in the next couple of years. This is something that is very important to me personally and also very important to me as BPW Canada president. This is a topic of reproductive rights and justice that should be important to every human, not just women, but all humans everywhere, because it's a slippery slope when you think of our reproductive rights and justice versus other communities as well. And I want to take the time to thank Meghan for joining us and to help educate us more on this topic. And with that, I'll turn it back over to Norma.
Thank you, Angie. So I'm going to start by actually introducing Meghan. She has over 2 decades of experience advocating for sexual and reproductive rights in Ireland, Canada, and other international fora. As Action Canada's Director of Global Policy and Advocacy, Meghan is responsible for leading the implementation of Action Canada's strategic objectives to advance sexual and reproductive rights in a global policies, with a particular focus on the UN human rights mechanisms. That's why she knows about the UN. Throughout her career, Meghan has collaborated with feminist activists, parliamentarians, civil society organizations, UN agencies, and government officials to support the realization of women's human rights, including sexual and reproductive rights. She's based out of Halifax, Nova Scotia. Of course, that's in Canada. So before I start, I'm going to put you on the spot, Meghan. You didn't know I was going to ask you this. So I would like you, Meghan and I chatted. We had a wonderful chat when we were planning for this. But I would like you to just tell everybody here what perhaps was what led you to this career and what keeps you in this career.
I love this question, and I love hearing everybody's origin story for how they got started in the work that they do. But I got started in this work very deeply when I moved to Ireland. It was 2003, and I was going there to do my master's degree, and I was 23, 24, and I didn't know a single person. I didn't really have any money, and very far away from my family and everything that I knew. And I only realized once I got there that abortion was criminalized. And I saw very, very clearly, and I thought, like, what what would happen to me if I needed to have an abortion? What would I do? I hadn't really thought about it not being an option before. And um, and so I was very fortunate with my professors in the course that I was taking. I was doing a master's in women's studies, who introduced me to the Irish women's movement and the Irish feminist movement. So she brought me along to grassroots organizing for protests and learning about the history of the abortion ban in Ireland, and what these amazing women were doing to organize together to change what was a very unfair and very harmful situation. And from there, I started to work in a sexual violence center in Ireland, and then moved to Dublin, where I worked with the Irish Family Planning Association, which is the version of Planned Parenthood in Ireland. And so, as you can imagine, working in Planned Parenthood in Ireland when abortion is criminalized, it's quite an experience. And I cannot tell you that, maybe to answer the next part of the question, what keeps you? When Ireland had its referendum to decriminalize abortion, I think is one of the most important days of my life. And I got to celebrate it with so many wonderful, interesting people, these women who had shown me such great care and solidarity and welcomed me, not as an Irish woman, into this movement. And I felt part of something bigger than myself. And I think that's why I continue to do this work. I feel it's very important to me to be part of something bigger than myself. But I think probably the best part is spending time and getting to know the most interesting feminists on the planet. Like, my life is just so enriched by laughing and eating and learning and fighting with these incredible people. So that's part of my origin story. Maybe the other part is I married an Irishman and I now have an Irish daughter. So that's the other part of the story.
That is wonderful. Thank you. That leads you. Why don't you show us what Action Canada is? You said you have some slides. You should be able to share them.
Yes,
And you can tell us about that
do.
before we start the questions that I have for you.
Okay. So I have a lot of slides, so just please bear with me. Where are we going? There we go. All right. So I thought I would start really by talking a bit about Action Canada for Sexual Health and Rights. It was founded as an organization in 2014, but it has over 60-year history through the organizations that made up the amalgamation process. So we had the Canadian Federation for Sexual Health, the Canadians for Choice, and Action Canada for Population and Development. And what had happened under the Harper years was that these organizations, who were once quite powerful and well-staffed and well-resourced, were systematically defunded through a conservative government, and one that was not supportive of women's rights or sexual and reproductive rights. And so these organizations were quite small, and so they came together and said, look, we can be stronger together. And so Canadian Federation for Sexual Health, it had organizations, mostly sexual health clinics across the country, and also worked on public information around sexual and reproductive health. Canadians for Choice, which was a big advocate for abortion rights in Canada, and ran the Norma Scarborough Emergency Fund, which supports people who need financial support to access an abortion. And then Action Canada for Population and Development, which focused primarily at the global level on global policies for sexual and reproductive rights, and specifically at the UN. And so I actually used to work at Action Canada for Population and Development back in the early 2011, 2012. I took a break, and then I came back to work for Action Canada in 2016 when it was now this amalgamated, amazing organization. So our roots are very deep. They go back a long way, and I've seen many changes in the sexual and reproductive rights landscape in Canada. But together, we have a sort of secret sauce in terms of how we work, which is grounded in human rights, an anti-racist framework, intersectional, and we are able to connect like what's happening globally with what's happening locally. I feel it's a very unique formula for an organization. So we cover a broad range of issues and a broad range of spaces, but we're still pretty small. Like altogether we're about 20 people. And we work together based on this principle that we believe that every person has the right to have control over their own bodies and have access to the information, services, and means to do so. So that is our guiding principle for all the work that we do. And so sort of we do a bunch of things, but you can kind of boil it down into these four main pots. And one of them is stigma-free sexual and reproductive health information. And sorry, I'm just going to move my Zoom box over a little bit. Information and education. We have an 24/7 access line where people can call, they can text, and we do community education as well. The Norma Scarborough Emergency Fund. So this is a very specific fund that supports people financially to access abortion. And I'll go into that a little bit later. But this is one of the key pillars of our work and is our main frontline service delivery aspect. We do a lot of advocacy to policymakers in Canada and globally, and we are active movement builders and believe in working in solidarity with a range of different organizations. So I have here our issues. These are four main things. We work on a whole range of other issues that are connected to sexual and reproductive rights, but in identifying, where the current landscape can benefit from our expertise and where we're well placed to be a leading voice is around safe abortion, comprehensive sexuality education, contraceptive care, and strengthening feminist movements for sexual and reproductive health and rights. So you see this acronym throughout my slides where it's SRHR, it's sort of a shorthand. So if I fall into too much acronym speak, please stop me, okay? But we also work on as I mentioned, a whole range of different issues. But we recognize that other organizations are better placed to lead, and we play more of a supportive role in that. So that's kind of the starting point. I think this probably leads us into our next part, Norma.
Sure. So actually, it's a great introduction because for those who didn't join us, Meghan also is going to be in New York, part of ECOSOC, part of the CSW. And when we were talking about planning this, because Meghan has experience across so much more of the world, and that's what her role in Action Canada is, the first thing that we thought she should talk about is how global human rights affects reproductive rights. We might think we're in a little silo in Canada. I have a feeling when Meghan's finished, we won't think that anymore. Would I be correct, Meghan?
I hope so. Yeah, so what I thought might be helpful to contextualize that conversation is just a snapshot. These are just some statistics of the state of sexual and reproductive health and rights around the world. So we have 41% of the world's women live in countries with restrictive abortion laws. So that can mean it's criminalized outright, or it is restricted to very certain conditions, like only in the case to save the woman's life, or very complicated procedures or processes in order to access abortion. 257 million women have an unmet need for contraception. So what this means is it's a person who would like to not be pregnant and does not have access to contraceptives of their choice. Either it's not available, or the choice is not the method that suits them the best. They can't access it, because they can't afford it, or they are prevented through restrictive familial or cultural norms from accessing contraception. So 257 million right now around the world, or 121 million unintended pregnancies every year. And of those unintended pregnancies, 61% end in abortion. So there's about 73 million abortions a year. So a very common procedure. But what we see is that when it's not safe, we see high rates of maternal death. And so there's 295,000 women and girls who die each year from pregnancy-related causes. This comes from a whole range of for different reasons, like hemorrhage, infection, sepsis, but it's also unsafe abortion is one of those leading causes. And we see that complications in pregnancy and childbirth are the leading cause of death among girls 15 to 19. And I'll go into that a little bit more as well. But and 1 in 3 women is subjected to sexual and or physical violence by an intimate partner or sexual violence from a non-partner. So you can see like the scale of the issues that we're talking about are absolutely massive. And they are happening in all parts of the world and including Canada. So before, what often happens when we talk about sexual and reproductive rights globally is we think it's something that happens over there. It's something that happens, in far off places. But I wanted to just contextualize this as well around what is the context of sexual and reproductive health and rights in Canada right now. And so while in Canada, abortion is decriminalized, we see that there are still huge barriers to access that remain. And so we've had a 187% increase in the number of people needing financial support to access abortion care through our emergency fund. And that is Action Canada and the National Abortion Federation are the 2 organizations in Canada, the only 2 that provide this, that have this fund. And it's basically cash to help people pay for childcare, bus tickets, hotels, and all the things that are needed in order to get an abortion that are not covered by your provincial health card. But on top of that, 40% of the people who are accessing our services are uninsured. So for the most part, that means that people who are not don't have immigration papers. These are international students. These are people who, they haven't renewed their health card for a whole bunch of reasons. And so the cost of those, they cannot pay. And in that case, they have to pay for an abortion and they cannot pay. And so we pay for the cost of the procedure. We see this huge uneven provision of abortion care across the country, particularly in relation to gestational limits, where the providers are. Most of them are in urban centers. Wait times are very, very different across the country. And then we have your reciprocal billing. So some countries or some provinces will allow you to not pay, and then you just charge it to they send the bill to wherever your provincial health card is from. Some of them won't do that, some of them do. We see it's like an uneven, and it all depends on where you live in terms of what kind of access you can get. And the impacts of that is that, the wait times means later gestation, and the later you get in your gestation, there's a lack of providers and then an increase in costs, which then, these issues compound each other. We also see medical abortion stockouts in Canada. We have 1 provider of medical abortion, which is a pill or a series of pills that you can take to end a pregnancy before 11 weeks, and you can take it at home. It can be prescribed by your family physician. You don't have to go to the hospital for it, but we have 1 provider in Canada, and when they have supply chain issues, you cannot access medical abortion from the pharmacy. And in some pharmacies, they don't even stock it at all. We have very poor sex ed across the country. It's very uneven. 1 in 5 Canadians do not have drug coverage. And I put this on here because if you don't have drug coverage, you have to pay for contraceptives. And for a lot of people, they cannot afford the contraceptive that they want. The cheapest contraceptive you can get is condoms, which are great, but aren't always the best method for a lot of people. Indigenous women are 2 times more likely to die in Canada from pregnancy-related causes. And there are over 150 anti-choice pregnancy centers across Canada. So these are centers that are specifically set up to dissuade pregnant women and girls from accessing abortion, and they provide misinformation and disinformation, which then, if we look at the pathway, it means you have later gestation, which means it's more complicated, it's harder to get, and all that. And I would say that these barriers exist, but they are the people who are most impacted by that are people who are already facing discrimination within the health system for a whole range of different reasons. Maybe it's because of race, age, they're Indigenous, their immigration status, all of that sort of thing. So I wanted to put in context when we're talking about global reproductive rights and the dire situation that it is around the world, that Canada also has a lot of work to do, and a lot of the foundational issues are rooted in the same things, whether it's in Canada or somewhere else around the world. So this is where we get onto a bit of like theory. I hope this is interesting for folks. I'm really nerdy about this. I could talk about it forever. But when we talk about human rights related to sexuality, gender, and reproduction, we often talk about reproductive rights and sexual and reproductive rights, but there is no special reproductive rights or special sexual rights. Rather, they're just like all human rights. They derive from a legal framework that is premised on the inherent dignity and of the equal and inalienable rights of all people. That's where human rights come from. And there's a whole series of, you have the Universal Declaration of Human Rights, then you have different treaties that were signed by states setting out some of these key principles, but they're so broad. And so for all the human rights that we think about, including sexual and reproductive rights, they derive from these very broad legal frameworks. And there has been tremendous progress on sexual and reproductive rights over the last 35 years that is due to the hard work and the painstaking work of advocates within working nationally, regionally, locally, and internationally. And so how we see progress on these issues, you have these very static documents, these treaties, and you think, well, none of them say sexual and reproductive rights, so what are sexual and reproductive rights? So you take this general principle, and I will go into a few more of them in a second, and the beauty of human rights is that you have this, the static document, but the principles and the application of them, they evolve through norms and standards that happen through the UN treaty body. So when a country is being reviewed on its human rights record, the kinds of issues that the treaty bodies will ask the country about and the recommendations that they make. Different UN resolutions. So when you go to the CSW and they have the outcome document at the end of the session, that helps develop these norms and standards that build on each other. There's a system of independent experts at the UN that are designated either for a specific country or on a specific thematic issue, where they really do a deep dive on different issues and look at how the human rights framework can be applied to contemporary situations. There's also legal challenges, so you can take cases directly to the different human rights committees. And then we have these broad intergovernmental agreements. So this is an ever-evolving world and standards and norms. And I'm very proud to say that such significant progress has been made over the last 35 years in terms of really setting a benchmark globally. Like, what is it that governments are supposed to do? to make sure that people can access safe abortion, that they aren't going to be discriminated against, that young people can access sexuality education. And so it's through this lovely dance that we work. It's I mean, everybody laughs at me when I say it's very creative, but like it is a very creative process in terms of how you can apply these sort of very stale, things that were developed 50 years ago into your modern day situation. And surprisingly, they're very practical in their application. Like most of the different human rights principles are followed through with recommendations for implementation that are issued by different treaty bodies and also through the UN resolution. It's very practical. We often think of human rights as being, this sort of aspirational, very abstract kind of thing. It's very practical. It's talking about budgeting. It's talking about how you do consultations. It talks about how accountability processes work. What are remedies? What do you need in order to make sure that your rights are fulfilled? So, I mean, I know I get very excited, probably more so than others, but I feel like there is this common misperception about human rights that they are very abstract, but no, they're very concrete. And it's an important way for advocates to hold their governments accountable for the obligations that they agreed to by signing these treaties. And here are some of the key human rights that are related to sexuality, gender, and reproduction. There are lots, but these are some of the principal ones. So this is the right to the highest attainable standard of mental and physical health. And what this means is there's a whole series of things, conditions that have to be met. So health services have to be available, they have to be accessible, they have to be acceptable to the people who are using them, they have to be of good quality, they have to be provided in a way that is non-discriminatory. And so all of those apply to sexual and reproductive health services. And because there is a particular focus on who is the least served through human rights, there is a particular attention is paid to the most marginalized groups, that there is a particular obligation to make sure that those services are available to the people who have the least power, the least money, the least access to resources, and are subject to discrimination, that these services have to be available to them. And it also means that the right to health means that it's not just not dying or not being sick, right? The language is, it's not just the absence of disease, but an emphasis on health and well-being. So what are the conditions that people need in their lives to be healthy? And that also goes beyond just access to health services. It involves how much money you make. It involves what are your working conditions, whether or not you have the freedom to, walk safely to the bus stop, how far away you live from the bus stop, all of those things. So it's quite I think of it as a positive right. It's a lot of the time we have here, the right to be free from violence and discrimination and torture. This is a positive obligation that the states have to make sure that you can access this right. And the next part is the right to be free from all forms of discrimination, gender-based violence, and torture. And this would apply, for example, if we're thinking in the context of discrimination, when we talk about, Indigenous women in Canada being 2 times more likely to die from pregnancy-related causes, it's not because they're Indigenous, it's because they experience discrimination in the system, in the health system that has been set up. So you have the right not to be subjected to that kind of discrimination. When we think about torture in many countries where abortion is criminalized, being forced to carry a pregnancy against your will has been found to be a form of torture under the UN treaties. And the right to privacy. You have the right to make decisions about your own body without government interference. And the decisions that we make about our sexuality and our reproduction, they're among the most private. And we have the right to be free from government interference. And they don't get to decide who we have sex with, how many babies we're going to have, if we're going to have babies, all the things. They don't get to be involved. The right to bodily integrity and autonomy. You have the right to have control over what happens to your body. And that means that you have to be able to give informed consent to anything that happens. So one of the legacies of sexual and reproductive health that I don't think the movement has fully grappled with is the coercive measures that have been put in place in global South countries, but also within global North countries around forcing people with disabilities to be sterilized. There are a lot of cases of Indigenous women in Canada who have been forcibly sterilized. We have the right to not have that happen to us. And we get to decide also when we want to do things. So, it's related in some senses to the right to privacy, but we get to decide if we want to be pregnant or not. We get to decide who we want to have sex with. These are part of our human rights. We get the right to freely determine if, when, and how many children to have. Now, this is probably one of the few articulated rights. This is how it's worded in the Convention on the Elimination of Discrimination Against Women. That's specifically talked about having children or not. So that one is a really airtight one. The right to receive and impart information means that I get to have good sex ed, and I get to, have access to information that I need to have my right to health fulfilled. If I don't know what it means when I miss a period, that has huge impacts on my life. And I also have the right to tell other people about what happens if they miss their period. And we see in many countries that sexuality education is demonized, it's stigmatized, and it becomes politicized in such a way that these topics are not allowed to be discussed. I mean, all this stuff that's going on in the United States around the curriculum there, that is in contravention of human rights. And really, as we go back to this, human rights as being practical, right? Because I'm all about the practicality of it. And at its core, human rights-based approaches and human rights, it is about creating an environment to support rights holders to claim their entitlements and duty bearers to meet their obligations. And so human rights necessarily involves all of us as individuals because we inherently have those rights, but it involves the state because they have an obligation in this system, right? And so there are always two parts to it. So that's why we talk about human rights as being a great tool for accountability, because often when we want to bring attention to things to the government, they may not pay attention. They're like, yeah, it's not important. We'll deal with that later. Whatever is, this system actually requires them to meet their obligation, and then there's full processes in place to hold them accountable to those promises. And the principles that we use when we apply this approach is based on accountability. So, you have to do what you say. And if you don't do it, then, we have to figure out what happened, why, and what you're going to do, what the state is going to do to make it better. Universality. This means that human rights are for everybody. There are no special rights for special people. We all have the same ones. They're just applied differently based on somebody's life experiences. And so, what we're seeing right now in particular is, some movements that are trying to deny trans people their rights, to say, oh, those are not women's rights. These are these are different and you're trying to somehow take away women's rights and deny trans people their human rights. It doesn't work like that. We all have the same human rights, and the rights that we fight for in terms of women's rights are based on principles of non-discrimination and universality for everyone. Interdependence, which means that you can't have the realization of one right without the other. They all rely on each other. Participation, as people, as rights holders, as the people who are impacted by the policies that governments make, we have a right to participate in that policy process. And then empowerment, and I mean like real empowerment, not sort of like, I don't know, L'Oreal, you're worth it kind of ads empowerment. This is really about you have the information and the means to be able to take action on the things that matter to you. And that if you feel that your rights are being violated, you know where to go, who to talk to, how to change the situation. I feel like I'm talking a lot and we've only just started. So, and I have maybe, I was going to give an example of how it works in practice around maternal mortality at the Human Rights Council. I don't know, Norma, how do you feel about time?
Sure, let's do the case study. It looks great. And I'm just going to say, if people have any questions or something, put them in the chat box. We'll see if we have time later too. Okay, go ahead with the case study. This is really interesting.
Thank you. Okay, well, it'll be a little bit brief, but so as I mentioned at the beginning, over 810 women and girls continue to die every day. That's how that number breaks down, from avoidable pregnancy-related causes. There are lots of global goals that are set up around the world and have been in place trying to reduce maternal mortality rates for a long time. They had been largely unsuccessful. I would say that the rate has gone down by about a third over the last 10 years, but it's one of the most off-track global goals in the Sustainable Development Goals, and before that, the Millennium Development Goals. It is consistently one that is the most off-track. And what the evidence tells us about maternal mortality is that the rates are highest in low-income countries, humanitarian settings, and among groups subject to discrimination in middle and high-income countries. That unsafe abortion is one of the leading causes of maternal death, and the risk is highest among adolescent girls. So for probably up until the mid to late 2000s, maternal mortality was only considered as a public health issue. Much in the way that we think of, COVID is just a public health issue, right? That it has no other dimensions to it other than this is a medical problem that we must solve. But we already know how to solve preventable maternal mortality and morbidity. It's not rocket science. All of the pieces of the puzzle are there. It's not some incurable disease that we can't figure it out. The medicine and the science and is there. What happens is it's rooted in poverty, systemic discrimination, stigma, lack of information, very harmful development aid and international financial policies. These are at the root of these high rates of maternal mortalities in low-income countries and also in high-income countries among people who experience the most discrimination. And so this is something that I had been fortunate to work on, was through this amazing coalition of civil society organizations, some states who were championing this, and different UN agencies. We began a process to develop a technical guidance from the Office of the High Commissioner on Human Rights on applying a human rights-based approach to preventable maternal mortality and morbidity. And what it did is it broke down all the steps that are involved in the planning and the budgeting and the reviewing on how you would actually integrate a human rights-based approach to health systems, but most importantly, also the social and economic system. So it really recognizes the conditions under which you live have such a huge impact on your ability not to die, for something that is absolutely preventable. And this may seem a bit technocratic, but it was one of the first times that a document or a guidelines had been issued at the global level for this kind of an issue, because like in Canada, but also in other places, the idea that we'd be looking at women's rights to bodily autonomy and how they are violated and how that contributes to maternal mortality is highly politicized. And so it took us about 10 years in order to do this, to get this guidance published and then promoted and then adopted in different countries around the world. And the emphasis in these technical guidance is around the positive obligations to fulfill the right to health and not just the absence of death. And this was the key, because when you look at it just from a public health lens, like we did with COVID, that it becomes just the absence of death is the marker of success. And we see that, like with COVID and with maternal mortality, when that's the only thing that you're focusing on, you're actually not going to reduce the rates, and you're not going to change the things that need to be changed in order for people to not only not die, but actually be healthy. And it really changed the way that the world understood and addressed preventable maternal mortality and morbidity. You cannot talk about it anymore as a public health intervention without considering the legal, policy, environmental, economic conditions under which women are dying from preventable causes. And there is still a lot of work to do. This is not, it's not like a magic bullet that solved anything, but it provided such an important piece of the puzzle on what are the things that we actually need to do to make sure that women are not dying from preventable causes when they're pregnant. I'm really proud of this work, and it continues on, and it's such a concrete example to me of what are the ways in which the human rights system can actually provide practical advice to different policymakers, but it also becomes an important tool for women in these countries to be able to advocate for themselves to their governments by using this framework to say, hey, you have an obligation to consult us when you're going to make a policy, or you're going to build a new hospital, or you're going to decide which medicines you're going to import, or you're going to decide where you're going to build the bus stop. All those things are really, really important. And then while I may seem very Pollyanna, there are a lot of limitations to this system. The framework, I believe, is very good, but the system is very flawed. There's a lot of inaccessible language, the processes, the institutions, the bureaucracy. We think sometimes the Canadian government has bureaucracy. Oh my God, the UN has like the biggest bureaucracy you could even possibly imagine. There is an individualistic approach to it, and a state-centric approach. So, the state is often, while we think of human rights as being, about all of us, is actually about holding states accountable for their obligation. Global human rights spaces are dominated by global North countries, organizations, and individuals. And I could talk about that part for a very, very long time, so I will spare you that. But if anybody wants to talk about it more, I'm happy to do that. But it means the geopolitical dynamics among NGOs, among states, are such that it's mostly wealthy white men from wealthy white countries that make the rules on how things work. There is an overemphasis on civil and political rights, and an underemphasis on economic, social, and cultural rights. So there is, see point above about who gets to be in charge in these spaces, but critiques of economic systems and international financial institutions and the harm that they cause to developing countries doesn't get discussed as much. And as much as we are, we love this system, it's non-binding. So sometimes, if states decide this is not important for me, there's not a lot you can do. So there are limitations, and it's an imperfect system. Well, it's very flawed, I would say. But the bones are good, right? We can work with the bones of the system. Okay, so maybe I'll stop there for now.
Let me unmute there. That's very interesting, because I think that really shows where we can have influence, but where we need to also work through our issues that you've identified. So thank you so much. I'm going to keep going here, and I hope I'm not skipping down too much, but I'm thinking that human rights begins the conversation. You talked about that. And the next thing we had talking about was global advocacy from Canada and across Canada, then the advocacy for this. Would that be a good topic for you to talk about next? Is the work that you're doing outside of Canada, and that gives exposure to Canadians, I'm assuming, and then the work that can be done across Canada, correct?
Yeah. So I think before I get to that point, one thing I had wanted to just mention, and I think it's part of the sort of the theme for this whole series, is around like reproductive rights and or versus reproductive justice. And I was wondering if I can just maybe say a couple things about that, and then I can move there.
That'd be great. Yeah, because we all think of it as the same thing. We're lumping it together. But reproductive rights, reproductive justice, what on earth could be the difference?
Well, it's interesting that you say that, because some people think they're, like at polar opposites, and other people think they're the same. So what we see from my perspective is that they're not mutually exclusive. And I have a quote here from Sister Song, which is a collective of Black feminists in the United States who actually coined that term, reproductive justice. And they define it as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. And so what you see is that reproductive justice is great friends with human rights as its foundation, but what it actually does is it expands the human rights framework to center Black, Indigenous, and other marginalized persons and communities' experiences and demands, as well as challenging the systems of oppression that lead to rights violation. And we have a lot to learn from reproductive justice movements, and the human rights system and human rights advocates benefit greatly from reproductive justice work. And what I would say is that they're very much intertwined, but I really see reproductive justice as it's created by Black and Indigenous and marginalized people's experiences. That framework speaks to a broader sense of justice than human rights systems do on their own, because the human rights system, was actually developed by these global North white wealthy men 50, or 75 years ago, I should say. We're in the 75th anniversary of the Universal Declaration of Human Rights. And so the system, when I keep saying that it's flawed, is because it was actually built by racist, misogynist, colonial powers. And so it has its limitations in terms of how it can respond to the needs of people who are not white, wealthy, global North. And it really the system resists expanding to making sure that all people everywhere have their human rights respected. And a reproductive justice framework, it allows for, this more space and more tools to make sure that it is more inclusive and representative of people's full lives, that they're not sort of siloed into these very narrow constructs. Recognize that people have lots of aspects to their life, and the environment in which they live impacts their ability to claim their rights at every stage. Yeah. Okay. So then this next part is what your question is around. How do we do global advocacy from Canada? What does that look like? Especially if we're trying to integrate and adopt and live intersectional, anti-racist, feminist principles in how we organize and how we advocate. And so how we do that is we use the human rights framework to ground our advocacy demands. And so we encourage the Canadian government to champion sexual and reproductive health and rights in its foreign policy, its international assistance, and engagement with multilateral institutions. So when we go to CSW, we've already been hammering to the government. The theme this year is around, education and technology, but comprehensive sexuality education is nowhere in the negotiating document. So for us, that's unacceptable, and we will be pushing Canada to make sure that they're raising it, and we'll be trying to get it in the document. We practice solidarity with sexual and reproductive rights defenders from around the world. And I use this word very specifically because often, the relationship of Canadian organizations with that are doing development work, it can often be a replication of the colonial dynamics that are set up, like global north, global south. And so what we try to do is, and we do it imperfectly, and I'm sure that we have lots of room to improve, but we actively try to practice solidarity. And so what that means is, for us, is that we make space for others to speak for themselves instead of speaking for others. And so, for example, one of the things that we organize is a cross-regional forum with young people from Latin America and young people from Canada, for them to, set. The idea is you bring these people together and they share their strategies and experiences and do some capacity building there. But actually, what we do is they build the young people from both parts of the world. They build the agenda together, they facilitate together, they report together, and then any sort of public facing material is their own words and expression of what they want to be out in the world, not what we as Action Canada wish they said. And so, because we often think like, gosh, I wouldn't want anybody to say, those poor women in Canada, they don't know anything and we're here to help them. Like, I would hate that. So why would anybody else anywhere else want that? And it also means recognizing like your own positionality in these relationships. So as much as we try to practice solidarity, we are one, we have more power in these relationships. So it requires a lot of thought and care and participation, collaboration. It means things take longer. They're a little bit messier, but it's totally worth it. We engage in global policymaking spaces to ensure SRHR is included from a rights-based approach. So again, the CSW, but we also engage with the World Health Organization. I participate in every Human Rights Council session, and a bunch of other UN stuff. Connecting these global sexual and reproductive rights standards to national processes in Canada is what I mentioned as our secret sauce. We participate in Canada's reviews before UN human rights bodies, and we advocate for improved access to sexual and reproductive health services, information, education across Canada, and most importantly, without discrimination. And I might actually, I don't know if I might actually go back to this slide because I was just thinking about the conversation you were having about your resolutions and whether these things might be helpful, but I wanted to illustrate maybe a little bit more of what this looks like in practice. So this is, we did a neglected areas toolkit, right? So sexual and reproductive health and rights are neglected areas within international assistance anyways. That gets like the least amount of money for a whole bunch of reasons. But within sexual and reproductive health, there are 4 neglected areas, the neglected of the neglected. And so what we did is we developed a toolkit to bring attention to these 4 areas and advocate for more attention to them from the government within their international assistance. So it's access to abortion, sexuality education, contraception, and advocacy for SRHR. And we were very successful working alongside colleagues in like-minded colleagues to get a commitment from the government of Canada for $700 million a year dedicated to sexual and reproductive health and rights from 2023 until 2030, with 500 million of that dedicated to these 4 neglected areas. We have the Sexual Rights Initiative. So this is, see my eyes light up when I come to this slide. These are my people that I advocate with at the Human Rights Council. So we are a coalition of 6 organizations from each UN region, and we come together to advocate for feminist, decolonial, liberation approaches to sexual and reproductive rights within the human rights system. And these are some of the most amazing people that I have ever met, and they taught me everything that I know about, working in solidarity in global spaces. And we've been together since 2006, and which is pretty rare for a coalition. For those of you who do coalition work, it's always, a bit tricky. And then in 2018, Action Canada holds the secretariat for the coalition. And in 2018, we were able to secure funding to open an office in Geneva. So we have 6 full-time staff in Geneva that are dedicated to the UN mechanisms and to, the work that they do is amazing. If you want to check out their website, it's sexualrightsinitiative.org. But this is a big piece of my work. So in addition to the nerdy norms and standards, these are my people. And in terms of more, domestic focused, we have, here's just an image of we're running a campaign right now for, the national pharmacare is being negotiated, and we want to see all forms of contraception covered within the national formulary. So this is, sort of policy wonkish, but using the framing of contraception as a human right to make sure that it's included in the negotiations that are going forward, and not just some forms of contraception. We want it all forms have to be included. We also, I don't know if folks had seen this, we did a brief recently following the Roe v. Wade overturned decision. There were some moves afoot across Canada, some government people, lots of well-meaning feminist organizations are like, we need a law that's going to enshrine access to abortion in Canada. And we were like, what? Wait, no, that's a terrible idea. And here's all the reasons why, because it's actually going to make it worse. And it actually makes us very vulnerable to criminalization and restrictions in the future. Right now, abortion is considered a health service under the Canada Health Act, and we believe it really needs to stay there, and that it is best protected when it is considered as a health service, not as one that would be exceptionalized in a piece of legislation that could very easily be repealed through another government. We have, these are some of the stats from our access line and our emergency fund. So we had, this is from last June, 366 calls to the access line, and we provided financial support to 17 people. So we helped navigate and support them financially for their abortion services. And we have a sexual health information hub, where it's got pretty much everything you ever wanted to know about sexual and reproductive health. You'll find it there. And then we have a book that's called Beyond the Basics. It's a guide for teachers around how do you teach human rights-based approach. How do you teach human rights-based sexuality education? What does that look like? What does it mean? All the tools that you might need in order to do that. And then, working in solidarity with other organizations, recognizing how everything is connected. We work with sex workers organization. We've had an amicus brief in a court case that was going through in Ontario, challenging the 2014 Protection of Exploited Persons Act, using the arguments of bodily autonomy. And so we supported through an amicus brief in that court case. And Status for All, Abortion Access for All. So we are supporters of the Status for All campaign that is urging the government to recognize and officially legitimize undocumented workers. As I said, when I talked about who are the people who are accessing our services, over 40% of those people are uninsured, and a lot of those being people who are undocumented. And being undocumented poses a whole range of health risks to people, including one that they can't access abortion. And so we are joining in calls with organizations across Canada to for the government to provide status for all. So see our lovely slogan, status for all, abortion access for all. And then I think I've kind of skipped right into, sorry, Norma, I don't think I followed your flow very well. These are just some ideas around, if how people can become more involved if you're interested. We have a newsletter, goes out every month. We have fantastic Instagram, Facebook, and Twitter feeds. We are starting to do public events again. You can find out about them when you sign up to our newsletter. You can donate to our work or other organizations working on social justice. Write to your MP or MLA to tell them that this is important to you. A lot of the time, people think everything's fine in Canada. There's no issues on sexual and reproductive rights. Not true. And we need all the help that we can get, and we need people in positions of power to make sure that we can realize these rights for everybody. I have here participate in Canada's upcoming human rights review. So one thing I wasn't sure if folks were aware of is that Canada is going to be reviewed as part of its universal periodic review process in November this year. And if you wanted to make a submission to that process, submissions are accepted until April 5th. And then the government is essentially going to be reviewed on its entire human rights record over the last 4 years. So we are making a submission alongside a few different organizations looking at these barriers to abortion access in Canada, specifically for Black women and for homeless women. But it's a really great opportunity to raise the issues that are important to you. And it's one of the most accessible, and I say that with air quotes, one of the most accessible ways to engage your government in the UN human rights system. And if anybody wants any more information, I'm happy to share that. We have fact sheets, we have resources, we have databases, we've got everything you need. Making a federal budget submission, highlighting the importance of funding SRHR. It actually matters to folks when they put their money where their mouth is. So it's really great to have positive statements, but the sexual and reproductive health infrastructure in Canada is crumbling, and it needs priority, attention, and money. And then encourage your kids to demand better sex ed from their schools. So this is something that my all the kids in my neighborhood, they're like, oh, you're the sex ed lady. Because I'm always asking them, what's the sex ed like in your class? And is it any good? Do you wish it was better? Tell your teachers. And so those are some ideas, but I have here our demands, but I might stop there and I don't know if you want it, what you want. If you want me to go straight into that or what.
I'm going to ask you to leave it for a second because I had one person who has a question. I wrote down a couple that might help, and then we can go into this and finish off with how we've done part of our resolution process. I'm going to ask Mina. Mina was the only one who reached out to me. If anybody else has one, put up your hand or something, and I'll see if I can see. Mina, would you like to ask your question?
Yeah, fantastic presentation, Megan. We have a resolution that we're putting forward on behalf of BPW Canada on technology, because technology is a very fundamental, foundational component in terms of delivering services, whether that's education, sex education, information on reproductive rights. And in terms of our resolution and approaching the federal government, we're going to be using Australia as sort of mainly from an infrastructure standpoint. Australia is very much like Canada, big country with a very sparse population, and they've been able to successfully implement networks throughout their entire area, and that's rural and remote communities that have Indigenous people or people who are not in the cities. And so when I think about all the great work that you're doing on your website and all the information, how does it get out to remote communities and rural communities if we don't have the infrastructure? And so that's my first question. My second question is, with all the work you've done internationally, is there a country that you look to and you sort of say, oh my goodness, they really have a strong foundation for this work? So those are my two questions.
Those are great questions, and the technology piece is absolutely essential. And you're right, for people, we have, high resolution graphics. It doesn't really work on dial-up. And so, what I was talking earlier about the right to receive and impart information, this is part of it, right? You have a right to access the information that you need in order to make the decisions about your health. And if you don't have access to the internet, the fact of life today is that you aren't able to access the information that you need. And so, we have different ways that we get our information out beyond the internet, but it's not the same. And there is a discrepancy in terms of the, how you can access that in private, right? We have our phone line, you can call that, you can text. And we also do, like, we print off different resources and send them around the country, and we have a network of doctors and nurse practitioners and midwives that we work with to make sure that folks know what we can offer them. But I think that sounds like a great initiative and an important resolution. And would be definitely strengthened by, the right to receive and impart information. You can find it in the International Covenant on Economic, Social, and Cultural Rights. And there will be a lot of discussion about this at the CSW as well. So hopefully you could get some further information there. But yes, this is definitely, access to the internet is a key part of sexual and reproductive health rights. And then in terms of which country would I look to, like every country is terrible in its own particular way. But for an abortion framework, I would actually say Canada has the best in the world, primarily because we don't have any legislation. And there are other countries that have much better social programs in place in terms of, how their health system is financed, what kind of contraceptives are covered. The Netherlands and, the Swedes are notorious for their excellent sex ed programs. But at the same time, we see that in the Netherlands, there's a very short timeline in terms of when abortion is available. So I think it's only available in the Netherlands up till 12 weeks. And across Europe, we have serious cases of racism within the healthcare system, not only for people who are there legally, but also undocumented migrants. There's deep racism across Europe and also across the United States. So no country has figured out how to do it the best. I think a lot of it depends on the strength of the civil society and the women's movement in those countries. France just passed a motion, I'm not sure the technicalities of it, but to have the right to abortion enshrined in their constitution. So that's great. And each country is very different in terms of what the issues are and what they need and what the demands are from the communities there. So it's like, no country has achieved gender equality. No country has eradicated violence against women. I mean, if women's rights were a priority for countries, it's not, as I said, it's not rocket science, right? It's not that hard to figure out. We already know what to do. It is because the political will is not there to prioritize women's rights, sexual and reproductive rights, racism, post-colonial legacies, enduring colonialism. It's not, you need the people who are in positions of power to actually prioritize that and resource it, and that's not happening anywhere. We still live in a racist colonial world. Sorry for that grim piece, but there are rays of hope. And Canada's abortion framework, I've done a lot of transnational comparison of abortion frameworks. Canada's by far the best.
Thank you.
I'm going to actually introduce you to Colleen Meghan. She's our BPW Canada Resolutions Chair, but she's got her hand up, so she must have a good question.
Thanks very much, Norma. And thank you, Megan. That was really excellent. I really enjoyed all that information. So basically, I think what I'm wondering about here is what we really, we always find ourselves faced with so many resolutions and so many ideas and areas of advocacy. And we're really trying to focus on be more intentional and focusing, and also just really leveraging some partnerships with other organizations. So my question to you is, what specifically could we partner with you on? Are there any partnership kind of opportunities for us to bring some strength in numbers to these to this issue?
That's my favorite kind of question.
I'm looking forward to the answer then.
Well, the number one thing that we have on our list of demands at the moment is the renewal of the Sexual and Reproductive Health Fund, which is set to expire in 2024. So this is a $45 million fund that was set up about 4 years ago through a lot of advocacy from my colleagues in order to get it into place. But that's what funds a large part of Action Canada's and the National Abortion Federation, their emergency financial funds and the infrastructure that's in place to be able to support people accessing abortion. And what we have discovered is that this funding has only been in place for us for about a year and a half. We only received it about a year and a half ago. And we got a lot of publicity about it, and people found it, because most of the time people only knew about our emergency abortion fund through word of mouth. And we helped maybe, 2-3 people a month. And now, we're helping like 20 people a month because more and more people are finding out about it and they are in need of it. And And so we have, through this program, like we have created this huge demand for people, and then the government is going to end that funding in 2024. So it's not just us and the National Abortion Federation. It also funds like the sexuality education programs for people with disabilities, for immigrants. It's about improving access to sexual and reproductive health information and services. And so through the fund has been very successful in what it has been able to do and generate, you know, sort of pathways of service and care. But then like everything is going to fall off a cliff in 2024. And so we have our budget submission to the federal government, and it needs to be in the budget this year that they're going to continue it next year, is that they need to renew that fund. And they need to make a commitment to that fund. And so starting from next week, we are doing a letter writing campaign to write to MPs, to write to the minister, put as much pressure as possible that we can to make sure that this fund get renewed, because a lot of people are going to be in a lot of, are going to be and it's going to be bad for a lot of people, and so that's an urgent thing that we are asking people to support. However, whether it's through these letters, whether it's your own communications, whether it's support, however you I'm not quite sure how you all do your advocacy, but any chance you get, if you can mention it somehow, that would be great.
I think that's also the fund. We have a resolution on access to sexual assault evidence kits, or the lack of access to them. And I think that the funding for those also comes from the SRHR fund, if I'm not mistaken. Something to look into. But is there a letter that you might want to share?
Oh, may I just interrupt, Colleen, just so you're aware, and Megan will know as well. Actually, on our resolution, we have 2 resolutions that are coming in addition to Mina's on the whole abortion. And one of them, we have asked for that fund. It's the only thing that the committee can agree on the wording. We haven't got an issue with it, and we've asked for it to be permanent, that the funding be permanent. It's coming through in the resolution. So we're already ahead of you guys there on that one.
Great. I like it already.
Keep going, Colleen.
So I guess what I'm wondering about, Megan, is there a letter? Like, do you have a form letter that you're using for your campaign that you might want to share with us, just a jumping off point?
Yes, definitely. It's going to be, the comms teams are going to be sending it out next week. So I can send it to all of you, and if you would sign it and send it, that would be incredible. Or write your own letter, whatever you think. We can use all the support that we can get. I'll be very frank with that.
I think it's something that we could take a look at, and we can even see if we want to add some of our other resolutions to it if it fits in, and we can put it out to all our members across Canada and get a little campaign going. I don't know. What do you think, Norma?
There we go. I was going to say, actually, I'll put it down in my on my list of things here as well, because that's what our group is looking for, things we can do.
That would be wonderful. Yeah, I will send it to you as soon as the letter is ready to go. This week is Sexual and Reproductive Health Week, so this is also an annual campaign we run every year, and we have a whole bunch of activities that are planned every year. And so one of the things, I don't know if you might want to look out for in your own cities, we've got a bunch of buildings to light up green in support of Sexual and Reproductive Health Week. So Angie, I don't know, I'm sure you know, but anyways, Peggy's Cove is going green for Sexual and Reproductive Health Week.
That's great to hear that.
Yeah, and Halifax City Hall. I don't know which ones are going from New Brunswick, but I was very happy to learn that the Halifax City Hall and Peggy's Cove agreed to do it.
Yeah, I'll have to look into that locally just to see. I know our mayor here in Moncton is actually a member of BPW, so maybe I can reach out to her and see if she's willing to, make us green.
That would be wonderful.
It would be amazing. We have the capability of at least our Avenir Center with different colors. So maybe I can kind of put a little nudge in her direction to do that.
That would be great. We have a list. I have lots of links to send all of you.
Yes, if
And
you could send them, that'd be great.
Yeah. Okay. Let me just make a note of that.
And anything else that we can do to help, like to just spread your information, your mission, just to support you. BPW Canada aligns with everything that we believe in, right? So we're always willing to partner up with like-minded organizations.
That's wonderful. Thank you. And it's so appreciated. And this is what it's all about. It's about us doing, making our voices heard. So very grateful.
If I could just add one more thing too, Megan. So we have a delegation of 20 people going to the UN, participating in the UN this year. And so if you think of any pointers for us while we're there, if there's certain things that you think that as a group that we might want to put our eyes on and put some voices behind, we would certainly welcome any suggestions. Thank you.
Great. Yeah, I mean, I think just right off the top of my head, I don't know, is your delegation in touch with the Canadian government?
Yes, Amanda has been in touch with Wage Department, so we're hopeful that we'll be able to meet with them while we're there. So we'll see what they have to say.
Okay, great. Well, if you happen to be talking about the outcome document and the negotiations, you could mention that it would be really great if comprehensive sexuality education was in there.
Do send anything, Megan, through to myself, and you can copy Angie on it if you want, and I'll just make sure it gets to the right people as well. And Angie will keep an eye on me. Great.
You may be sorry you asked. I always have ideas for things for people to do.
I love it. Yes, this is exactly what we're trying to gather and do. So this is great. Well, I think
we've also guided the delegation to have some speaking points ready. So if we have some of that verbiage and so on, because you know what it's like when you're in the UN and you see somebody, you grab them, you might get 2 minutes. So you want to make sure in those 2 minutes you use them pretty wisely and get your point across. So that'll give us an opportunity to do that. So share any points that you've got to help us prepare.
Wonderful. I can definitely do that.
Thank you. Well, we've come to kind of the end of our allotted time, so I'm actually going to ask Angie to close our session. Thank you to everybody who attended. I'm first going to say that, and I do know that there are several women who did register for this. I know one of them is Doris. Doris has been a member for over 35 years. Her husband, we think he had surgery today. We think it's an eye transplant, or part of his eye. They're doing surgery to transplant something. So we're hoping that things are okay. She was going to try and get on, but I suspect she's busy looking after him. And I know there were some newer members as well that were very interested. So I took some pictures, Megan, especially of you. And maybe I'll just take a quick picture here of the people who are on. I'm not going to take the chat. So smile, everybody, if you're on, and if you don't want to be on, that's fine too. And there you go. And thank you. And Angie, over to you.
Thank you very much, everybody, especially Megan. The information you provided was really a great start to this conversation. When it came time to choosing the priority themes for BPW Canada in August, it was something that I thought very long and hard about. And as we know, this theme wasn't declared, until recently. But you shared your background story. So before we sign off, I'll share mine a little bit with you. I joined BPW not that long ago. I'm a fairly new member. I believe it was only in 2018 that I joined. The reason I joined, at the time I was just a little bit over the young BPW threshold. So I was joining just as a regular member, and I was looking for an organization where they have some advocacy. Everybody has gone through these situations in life that shape us who we are, and I'm no exception to that rule. I'm a feminist. I believe in equality among all humans, no human above any others. And I wanted to get involved in something that aligned with my own beliefs. And this was something that I felt strongly about. And it's inspiring to see the way that I looked at things. And something that you said earlier in your presentation, when you were talking about empowerment, it really struck a chord with me, because you were discussing about what the definition of empowerment would be, about implementing change and being a part of change. And that really was the reason why I joined, because the way that I looked at things was, there needs to be change in the world. And what better way to see change happen than to be a part of change and not just be complacent? So it really struck a chord with me, and I'm really glad that you mentioned that. And as a mom of 16-year-old girl and a 13-year-old boy, I'm trying to instill these lessons in both of them as well. I want them both to believe in equality among humans, and hopefully I'm succeeding in this message. And people just need to do more than rest on their laurels and just expect others to do the work for them. So the fact that we have so many like-minded individuals working with us and these partnerships and our members, it's really inspiring. So I really want to thank you for taking the time. I know it's late for us, but taking the time to come and speak.
Thank you. Thank you so much, Angie. And thanks to all of you, and to Norma for prepping me very well. I think I went a bit off script. Sorry, Norma, but thank you for inviting me. I love talking about these issues, and I love hearing about what other women are doing to forge the change that they want to see, like you said, Angie. And so I'm really grateful for the opportunity to share some of this with all of you, and I'm also really grateful for your offers of support for this work and to Action Canada. It means a lot to us. I call us a very small but mighty team, and so we really appreciate all of the support from every corner. And yeah, just thanks a lot for inviting me. I really enjoyed talking about it, and in case you couldn't tell, I could probably talk for another 2 hours about it. So, but I won't do that to all of you. But if there's anything that we can do in the future, or anything that we can support with, we'd also be really interested to talk more. So thank you so much.
We will stay in touch, Megan. I have your email address.
Hopefully we'll see you in New York. So just let us know.
That's right. I have
Events,
a
and
list of
we'll-
things to send.
Yeah, for sure.
Wonderful. Thank you so much, everybody. Bye.